Ashwin Sharat. So as I have promised you, today we will be dealing with the diagnosis of COVID-19. But before getting into the diagnosis, I will strongly recommend you to watch the pathophysiology or pathology of COVID-19 in my previous video. Because the pathophysiology or pathology will tell you why all these parameters that we are going to discuss are measured. So let's get into the diagnosis. So before getting into the diagnosis, consider yourself as a healthcare professional and a patient comes to you with the first three primary symptoms of COVID-19, that is fever, cough and shortness of breath. But only with these three symptoms we cannot say that the patient is having COVID-19, because right now it is the COVID-19 outbreak. These symptoms are similar to that of a flu that we all have experienced in our life. Along with these three symptoms, the patient can also represent himself with certain other symptoms such as the URI symptoms or the gastrointestinal symptoms. The URI symptoms includes rhinorrhea, congestion, sore throat, whereas the gastrointestinal symptoms include diarrhea, vomiting, nausea, etc. So all these symptoms, the first three symptoms along with any of these symptoms always just sounds like that of a flu. So first primary objective will be to rule out flu, then we will go further for COVID-19. So in order to rule out flu, what we will do? We will run a flu test by using a swab. The swab can be nasopharyngeal swab or oropharyngeal swab. And we will culture the swab sample for influenza A or influenza B. And thereby we will rule out the influenza or the flu condition. Now since the flu has been ruled out, now the chances of the patient having COVID-19 has increased. So the patient will also said, I have talked about fever. The patient will be representing with fever. What is actually a high fever? See, the normal body temperature is somewhere around 98.6 degree Fahrenheit. So fever will not be something that is just above 98.6 degree Fahrenheit. High fever is not something 98.8, 99, 99.5. We will consider a fever to be a high fever if the temperature is above 100.4 degree Fahrenheit. Only if the temperature is above 100.4 degree Fahrenheit. So the patient comes up with all these symptoms. We ruled out the flu. Okay, the chances of flu. Now the chances of COVID-19 is high. We will get the sample of the patient by swab, that is nasopharyngeal or oropharyngeal method, and we will send the sample for RT-PCR. The RT-PCR refers to real-time polymerase chain reaction. See, there is a myth that only the swab can be cultured to undergo RT-PCR. No, we can do the RT-PCR of any fluid of the body, or we can do the blood, we can use the sputum of the patient to undergo RT-PCR. But the main issue with RT-PCR is that the sensitivity of RT-PCR is somewhere around 30 to 80%. Somewhere around 30 to 80%. That's why we have come across the news that a patient undergoing RT-PCR tests negative for COVID-19 and weeks later he tests positive for COVID-19. And this is the reason. The sensitivity lies between 30 to 80% only. Another issue with RT-PCR is it takes a lot of time. It's a time consuming process. RT-PCR is a time consuming process. So if I give my sample today for the RT-PCR, the result will not be available within 1 or 2 days. It will take a long time. And between that time, the condition of the patient can get worsened. So now we got the patient with these symptoms. We run the flu test. We have eliminated the chances of being flu. We will send the sample for RT-PCR. Now within the time the RT-PCR is being done, we will go to some laboratory investigations. First, we will take the patient and go for CBC, that is complete blood count. In complete blood count, we will monitor the patient's RBC level, platelet levels and the WBC level. Now why WBC levels are important is, till now it has been observed that in more than 80% of the patient there is a condition known as lymphopenia. In more than 80% of the patient there is a condition known as lymphomania. That is the reduced level of a very low level of lymphocytes. That's why we will carry out CBC for RBC, WBC and platelets. Along with CBC, we will also carry out CMP. Now what does CMP stand for? CMP stands for Comprehensive Metabolic Panel. Using CMP, we can identify the information about patient fluid balance, electrolytes, sodium and potassium level, along with how well the kidney and the liver are functioning. We can understand that. Okay. So, as we know, whenever there is a COVID-19 infection, in the pathology class I have said that COVID-19 infection will lead to vasodilation, to hypotension, to septic shock, and due to that there will be reduced perfusion to the kidney. So when we will do the CMP, we will observe in COVID-19 patient that there is an elevated creatinine level as well as there is an elevated blood urea nitrogen level. See, reduced blood perfusion to the kidney, that means kidney is unable to filter all the blood properly. That's why there will be elevated creatinine and burn levels. If the same condition, that is reduced perfusion to the liver, there will be increased AST level, there will be increased ALT level, and there will be increased bilirubin levels. Okay? And during this condition, when there is reduced perfusion, the liver will release certain acute inflammatory proteins such as interleukin 6, TNF alpha, and fibrinogen. The liver will release some acute inflammatory proteins such as interleukin 6, TNF alpha, and fibrinogen. Now take a situation where the condition is very bad, that the perfusion to the heart for the patient is also low. At that time, there will be a marked elevation in the CKMB and troponin levels. See, CKMB stands for, the CK is a creatinine kinase enzyme, and the creatinine kinase has three isoenzymes, that is CKMM, CKMB, and CKBB. The CKMB is particularly for the heart. So it represents, if there is an elevated level of CKMB, it shows that the heart is facing some problem. And troponin, as we all know, troponin is the biomarker for heart. So whenever the heart is facing any kind of issues, any damage, reduced perfusion of blood, there will be elevated troponin levels. So we have taken all these parameters. Along with that, certain inflammatory parameters will also be elevated in case of the COVID-19 patient, such as there will be increased C-reactive protein, there will be increased increased D-dimer level. Whenever there is an inflammation inside the body, what will be elevated? Yes, erythrocyte sedimentation rate. There will be erythrocyte sedimentation rate. There will be an elevated ferritin level. What is ferritin? Ferritin is a protein that binds to the iron. So whenever there is situations such as hypothyroidism or inflammation or rheumatoid arthritis, the ferritin levels will be elevated. And there will be elevated lactate dehydrogenase level. There will be an elevation of LDH level. So these all inflammatory parameters will also be elevated. So these are the factors that are elevated whenever there is a COVID-19 condition. We need to monitor one more thing, that is the procalcitonin level. The procalcitonin level. Listen, whenever there is a viral infection, the procalcitonin levels will be normal. Okay. Now consider a condition where the COVID-19, that is the viral infected patient, encounters a super infection, and that super infection will be due to a bacteria. Right? The COVID-19 patient will be having normal procalcitonin levels. But if he develops a super infection due to a bacteria, there will be elevated procalcitonin levels. So, procalcitonin levels are elevated only if there is a bacterial infection. So that's why the procalcitonin levels should be monitored in order to rule out if there is a super infection or not. Now, we have done all the parameters, laboratory investigation. We are still waiting for the RT-PCR to come. We can also run down certain scanning tests. The scanning for COVID-19 includes chest X-ray, CT scan, and ultrasound. Whenever we go for a chest X-ray, we can see whenever we go for a chest X-ray kind of thing, we can go for certain patterns. We can see some patterns, that is ground glassy patterns. See, the patterns that you can right now seeing that images are the patterns of ground glassy. Okay. Now when we go for the CT scan, in CT scan there will be consolidations. In CT scan we can see consolidation, because in pathology we have learned that in the alveoli there will be filling up of macrophages, neutrophils, or other inflammatory mediators, the fluid, the debris of the type 1 and type 2 pneumocytes. So that all fills up and forms a consolidation. Right guys? Then there will be a crazy paving pattern. There will be a crazy paving pattern. The crazy paving pattern will be due to the membrane thickness. See, whenever there is a damage to the membrane, there will be membrane thickness that will show a crazy paving pattern. Now we can go to the ultrasound. In ultrasounds also we can observe certain consolidation. So why these consolidations occur? Yes, I have explained you. In the alveoli there is filling up of the macrophages, the fluid, the debris, everything. So there will be consolidations in the ultrasound also. And there will be presence of certain B lines. So these B lines are occurring due to the damage to the lungs. So whenever there is a damage to the lungs, there will be B line. And also there is pleural line thickening. There will be a pleural line thickening. So these are the things that we can see in the scanning reports. In chest X-ray, in the chest X-ray we can see for ground glass opacities. In the CT scan we can see consolidations and crazy paving patterns. I have explained why these are seen. In the ultrasounds there are consolidations, B lines and pleural line thickening. So these are the things that happen in the scan. So apart from this, there will be certain other markers or certain other parameters that will be elevated. See, in COVID-19 patient, I have explained in pathology, due to inflammation and inflammatory mediators, there will be increased heart rate. Right? Because there is stimulation of the sympathetic nervous system due to reduced partial pressure of oxygen. There will be increased respiratory rate because there is a hypoxemia condition, the body requires more oxygen, so there will be elevated respiratory rate condition. Along with that, there will be reduced SpO2. Now what is reduced SpO2 refers to is somewhere that is less than 93% of SpO2. If there is less than 93% of SpO2, that is what we call as hypoxemia condition, or the SpO2 levels has been decreased. So these are the parameters apart from the RT-PCR we will conduct, and these are the reasons why we will carry out these parameters. So now we will wait for the RT-PCR to come, and then finally we will diagnose the patient. If unfortunately he found to be positive in RT-PCR, we will diagnose the patient with COVID-19 and then further get into the treatment. The treatment of the COVID-19 with all these informations and the pathology we will be dealing in the next class. Till then, stay safe, take care and keep learning.